Hi everyone, my name is Pumelo Mkhonyana. This is little Garis over here, and I'm a fourth year physiotherapy student at sefako Makgatho Health Sciences University. And today, my group and I, Group 1, will be doing a video about the role of physiotherapy in pediatric cerebral palsy. Now, some of you guys might ask yourself, what is cerebral palsy? Cerebral palsy is a group of disorders that occur in the brain and affects normal development of muscle tone, posture, and movement. Now, the risk factors that can lead to cerebral palsy can happen in three ways: before, during, and after birth. Before birth, it can happen if the mother takes in alcohol, drugs, or has an infection in the womb during pregnancy. And then during birth, it can happen if the baby comes out with their feet first and their head is stuck in the birth canal and have a delayed first breath. And then after birth, it can happen if the baby sustains any injury to the head that will lead to a traumatic brain injury. The common symptoms of cerebral palsy include muscle weakness, muscle stiffness, abnormal posture, and delayed development. There are 5 different types of cerebral palsy. There is ataxic cerebral palsy, which is seen when a baby has incoordination and impaired balance. There is athertoid cerebral palsy, which is seen when a baby's muscles actually fluctuate between being stiff and loose. And then there is hypotonic cerebral palsy, which is seen when a baby has loose muscles and floppy limbs, And then there is spastic cerebral palsy, which is seen when a baby has increased tone and stiff muscles. And last but not least, mixed cerebral palsy, which is when a baby presents with 2 or more types of cerebral palsy at once. Children with cerebral palsy are managed holistically by different types of health professionals. Just to name a few, they are treated by doctors, nurses, physiotherapists, occupational therapists, speech therapists, and pharmacists. These people work hand in hand together in order to improve the quality of life of the baby. But in this video, we'll be focusing more on the role of the physiotherapist and the caregiver. There's a lot of things that a physiotherapist does in order to make sure that the baby reaches their developmental milestones. Now, to find out more about cerebral palsy, or if you have any questions, please go to your nearest clinic or your nearest doctor or any health professional that was mentioned above. Okay, mommies, are you guys ready for this?
Yes.
How are your babies? How are your babies today?
They're good.
Okay, let's get started then. All right. Now, those are going to be very simple exercises. Now. So they're going to be passive movements. We're going to be doing what we call passive movements, as well as passive stretches, as well as facilitated sitting. I'll just explain them as we go. Now, so the first movement that we're going to be doing is going to be on the ankle joint. Now we're going to be doing both range of motion and circulation, just so that the muscles can just move, since the babies can't do that by themselves. Yeah? Okay, so this is how we're going to be doing it. You hold the baby like this, and then you're just going to be flexing and extending the ankle just like that. Yeah? We're going to do that 10 times. 3, okay, 4, okay, 5, good, 6, 7, 8, 9, and 10. Okay, that was for the ankle. And then now we're going to be moving on to the knee. Yeah? Okay, so please make sure that you're holding under the baby's knee, just in case your baby has hypotonia, and when you're taking it down, it might dislocate. Okay? Okay, now let's do it. Okay, just like this. 1, good, good. 2, good, good. 3, nice, nice. 4, good, good. 5, 6, 7, okay. 8, good. 9, good. And 10, okay. Now, that was the knee joint, okay. And then now we're going to be moving on to the hip joint. With the hip joint, we're going to be doing straight leg raises, and just so that we can increase range of motion, as I said, and just to improve circulation down the leg. Okay, so this is how it will be done. You're going to hold here, just like the baby, like this, and then straight, just going to bend the hip just like that. Babies are very flexible, by the way, So don't be surprised if your baby can extend further than you. Okay. Now we just bend it like that. Okay, that's 3, 4, good. Okay, 5, good. Okay, 6, okay. 7, good. 8, good. 9, good. And 10, okay. And then now we're just basically going to be doing the exact same thing for the other leg. Alright. Okay, let's just do it quickly. Let's start with the ankle. 1, okay. 2, okay. 3, 4, good. 5, okay. 6, 7, 8, 9, and 10. Okay. And remember, ladies, please be careful of your back. Yeah? If you feel like there's something wrong with your back, please change your position to a much more comfortable one. Okay? Yes. As you can see, she's already getting comfortable. Miss Arata as well. Good. Okay, I'm just gonna be like this so that the camera can be able to see me. Now, okay, now we're gonna be moving on to the knee of the other leg. Okay, let's do that again. Remember, hand on the knee to avoid any dislocations. Okay, babies are ready. Okay, let's go. 1, 2, good. 3, good. 4, good. 5, good. 6, wonderful. 7, good. 8, good. 9, good. And 10, nice. Okay, now one more time on the hip joint of the right leg. Okay, let's go straight. Remember, straight, just like that. 1, good. Okay, 2, good, Miss Sulanang. 3, that's good. 4, nice. 5, Miss Arata, that's good. 6, 7, 8, good, Miss Desiree. 9, and 10. Okay, let's let the babies have a bit of a breather, but we are basically done with the lower legs. Okay. Oh, he looks tired already. Wow. All right. Just dress him nicely. Okay, and then now we're just not gonna do a bit of pelvic movements now, just so that the pelvis doesn't become stiff as well. All right. So now with this movement, you're gonna hold the baby. Your thumbs are just basically gonna be on the hamstrings, be behind their thighs, just like that. Okay. And then you're just basically gonna do that to the baby, right? Just like that. Miss Areta, your hands like this. Hold, yes, just like that. And then move the pelvis. Yes, just like that. Just like that. Good. We're gonna do that 10 times as well. Okay? 1, good. 2, good. 3, good. 4, good. 5, good. 6, good. 7, 8, 2 more. 9, and 10. Okay, that was good. That was good. Okay, now since we're done with the lower limb, we are now going to be moving on to the arms. Okay, now the arms as well, same principle. We're going to be moving from the fingers to the wrist, to the elbow, and the shoulder. Okay, basically we are just trying to mobilize every joint on the baby's limb as possible. Okay, so, excuse me. Okay, now when we're going to start with the fingers, please do not put your thumb or anything on the baby's palm, as it activates the reflex of the baby grappling. Okay, so what you're going to do, you're going to take this hand, hold the thumb out, right? And then this other hand this thumb will be holding the kid's fingers here, right? And then you're going to be doing that. You understand? And then with your thumb, you'll do that, right? 10 times each as well. Okay? Simple enough, right? Okay. You're going to hold the thumb like that, right? And then you're going to extend the fingers, right? In and out. Okay, good. Let's go. Just like that. Okay, 1, okay, 2, good, 3, 4, good, 5, good, 6, 7, 8, 9, and 10. Okay, that was good. All right. Okay, the baby's muscles have now been activated. The blood is moving. Everything is fine. Okay. Then now we'll be moving to the wrist joint. We're just gonna flex and extend it. Simple as that. Now, okay. Now let's go. Okay. Let's start. Okay. 1. Okay. 2. Good. Sometimes the baby might feel stiff. No? So you're gonna need to put in a bit more pressure, right? 3, okay, 4, 5, 6, 7, 8, 9, and 10. Okay, that was the wrist joint. Okay, now we're gonna be moving on to the elbow joint, right? As we're going from distal to proximal. Okay, now let's start. With the shoulder as well, flexion and extension. Flexion and extension. Nothing complicated. Now, we all got it? Okay, remember, we have to handle the baby properly. So remember, your hand must hold just like that, and then do that. Now, okay. So we're going to hold the baby like that. Just like this. Okay, so now, you got it? Okay, good. 1, 2, 3, 4, 5, 6, 7, good, 8, 9, and 10. Good. Okay. That was the movement for the elbow. Now we're going to be moving to the shoulder joint. The shoulder joint. You're doing shoulder. Oh no, it's cool. You can always, when we do shoulder now, you can just simply do elbow, okay? But remember, the nice way is to move from here to here, right? Don't skip this. But for now, since we made a mistake, it's fine. Yeah? Okay. So now when we do shoulder, we do the elbow, just like that. Okay? Alright. Now with the shoulder joint, remember, it has many movements. There's this abduction, 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 abduction. There's a flexion and extension, right? And then there's also, you can also just do, circumduction, which is all the movements combined, right? Just to make it more mobile, all right? And activate more muscles. All right, let's start with flexion and extension, yeah? Just like this. 1, okay, 2, okay, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, that was good. Now, all right. Now we're going to be doing abduction and abduction. Yeah, which is basically this, right? Just going to be doing that. Now, okay. Now let's start. 1, okay. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. As well, we do that for both limbs. Now, so let's give a baby a breather, and then we'll continue. Now, okay. Oh, he's looking good over there, huh? All right. Now, remember, if in between the sessions you feel like you need to stretch or you need to do something, you can always take a breather as well. Now, you can just stand up, stretch your legs. Let me do that as well. Actually, I'm feeling kind of tired. Just get up, stretch your legs. You understand? Just move them. Make sure that you're still fine, right? Stretch your fingers, stretch your arms, just like that. Because at the end of the day, we don't want you becoming sick as well, hey? So it's like that, okay? Are we good? All right, let's get back to the babies now. Let's get back to the babies. Good. Just like that. Okay. All right. Okay. Are we ready again? All right. Let's do the other this is the other hand. Fingers, wrist, elbow, and shoulder. Let's try and do it a bit faster this time since we already know what we're doing now. Okay. Remember, hold the thumb, and then we're going to be moving the fingers. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Good. Let's move on to the rest now. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Move on to the elbow, flexion and extension. Remember? Okay. Quickly. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Let's now move on to the shoulder. Now, okay, remember the shoulder? We're going to do flexion, extension, abduction, abduction. Then we go. Okay? Okay, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Great. That was amazing, right? Now we made sure that we moved each and every joint as possible on the baby's limbs. We just helped the baby with range of motion. We just helped the baby with circulation as well, right? Now we're going to be moving to facilitated sitting. This will help the baby with head control and just building muscle memory for the baby, especially those with delayed milestones and delayed development, right? It will help them remind their muscles that they can actually sit by themselves, right? Okay. So this is how it will be done. Pick up your baby, right? Make sure you only support the head if your baby has poor head control, right? And then you hold the baby, make sure that they're supported, right? You can hold the baby like that, no? And then you put them on the floor in a sitting position, just like that, no? And then you make sure that you support the baby's head, no? And then to take this exercise a step further, you can make the baby reach for objects around, right? Yeah, you can do just do that. You understand? Help them do it just like that and just like that. But since we don't have toys with us, you will have to do it in your homes. Yeah? Okay, let's just try and get the babies into sitting just like this. Yes, good. Turn them on your chest. On your chest. Good. Just like that. Good. That's good. That's good. That's good. If you can keep the baby here for at least 30 seconds, remember you're also sitting here with them, but you can always put the baby on the couch, make them watch TV, make them watch cartoons while they sit by themselves. Make sure they are well supported on the couch and the baby will fall over. Okay? So yes, that concludes today's session. I hope you guys learned a lot. I hope the people who are watching this video learned a lot. Thank you very much, guys. And yes, that concludes it. All right. Okay, thank you.